So there's that part. But then on a deeper level, there are the feelings about it. Should I be on it? Should I not? What do people think about it? What do I think about it? And then if they do decide to go on it, what's that process like while they're losing the weight? And then once they've lost the weight, what's that like?
Welcome back, friends, to the Erie Wellness Podcast, where we explore a wide range of wellness topics, highlight the incredible local professionals right here in our community, and encourage you to advocate for your own health and well-being. Today, I'm joined once again by Gretchen Kahre of Downtown Erie Counseling. This is actually Gretchen's second appearance on the Erie Wellness Podcast. If you missed her first episode, which happened last June, we talked about middle life mental wellness and life transitions. It's episode 16 and definitely worth adding to your playlist. In this episode, we're talking about the mental and emotional side of GLP-1 medications, something that often gets overlooked. So whether you're personally taking a GLP-1, considering it, or supporting someone who is, this conversation is really insightful and honest and incredibly helpful for understanding all of the things that go on for people who are navigating GLP-1 medications. So welcome back, Gretchen.
Thank you. I'm so glad you could come back. It's really nice to have you in my office again.
Yes, and you have such a cozy space, and I enjoy your company. So thanks for having me. Why don't you share a little bit for anyone who has not had a chance to listen to your very first podcast episode that you did? If you want to share a little bit about your background, how you got into therapy, and then we'll kind of dive into today's discussion.
So I was born and raised here in Colorado, and somehow straight out of high school, when I went into undergrad at CU, I declared my major in psychology. I don't know anybody who does that. I guess I just wanted to, pick something and do it. And it stuck with me. I always had this question of how does mind function? From a young age, I was always trying to understand about that and have wonder about that. And then choosing a graduate school, I knew that I needed to go to graduate school in order to work with people. So it turned out that Naropa University just made the most sense for me in terms of what I valued and how I thought about things. And so I got my master's from Naropa and went into counseling right out of that. I commuted for a long time, for over 25 years. And then when the pandemic hit, I decided I didn't want to drive anymore. And so I also recognized that Erie at that time, this was around 2021, there weren't very many therapists. Everybody was driving somewhere else to go to therapy. And so I thought, well, what better place to open my own, move my private practice here. And also at the time, I was really recognizing that for women of middle age, women who are of menopausal age, there really wasn't much available. There's been so much, it's been such a booming investigation since then. Now there's so much out on mental health for women in menopause. There's so much more support. But at the time, there really wasn't anything. And I got so irritated about it that I thought, oh, well, then I'll start. So, and now recognizing, women of menopausal age are starting to discover the option of GLP-1s, because with menopause, weight changes. With hormone changes, weight changes. And so it's a big issue. So those two have come together. That kind of leads into, well, why this?
Right. Today's conversation.
Yeah.
But great to bring awareness that so many people, it's just part of menopause, or, kind of my life is just going downhill. I think we talked a lot about that in your first episode of, as human beings, we need to be able to encourage to thrive in all seasons of life. So
yeah, that's right. Yeah, and it seems that with so much more attention on menopause medically and I think psychologically. It's allowing women to discover, oh, this is also a thriving, as you say, period of life, season of life. It can be, if I choose that,
Right.
But for such a long time in our culture, it just was the next step was death. Which
Hot
seems
flashes
pretty,
and death.
it just seems quite bleak.
Yeah.
Yeah.
Why don't you, did you start seeing it with clients, the GLP-1 frustrations or bringing up different emotions?
I noticed, I just started to notice with my clients, more and more were mentioning that they were considering starting GLP-1s, or they came to me and were already on a GLP-1. And so I just started to notice, wow, this is something that is really growing. And then, of course, it's in the media. There's all kinds of advertising. I mean, it's really been a big splash. And so I started to educate myself about it because, one, it's a medication. And so I'm always needing to know, like, what kind of medications are my clients taking, either for psychological or hormones, and now with these GLP-1s, and how do they interact?
Yeah.
And are my clients aware that there is, an interaction? They impact each other. So there's that part. But then on a deeper level, there are the feelings about it. Should I be on it? Should I not? What do people think about it? What do I think about it? And then if they do decide to go on it, what's that process like while they're losing the weight? And then once they've lost the weight, what's that like? So
yeah, right.
Yeah,
because you said it's uncovering a lot of things.
That's right. That's right.
So like you said, GLP-1 medications are getting a lot of hype. We're seeing them in the media. We're seeing them when we log on to the internet and scroll. So can you educate our audience just a little bit about GLP-1 medications for anyone who just wants a little knowledge of what they are, what they do, how they interact with the brain in particular, and then any important things that people should be considering when talking about GLP-1 medications?
Yeah, it's really important to kind of understand, because there's a lot of fear around them, which is understandable. They're very powerful medication. So what a GLP-1 is, a GLP-1 is a peptide. And a peptide is, it's made up of amino acids. And so I like to kind of think about it as, so proteins are also made up of amino acids. So proteins are more complex. They have more amino acids to them. They're more like a 3D printer. They create these different shapes. A peptide is more simple. It's more like a 2D printer. And so it is a naturally occurring substance in the body. We're made of peptides and proteins and amino acids, as you might imagine. But the thing about a GLP-1, so they've been around, they've been in our body forever, but as far as looking into them for medication purposes, they have been around for a very long time. And they were originally looked at for diabetes medication. In their kind of evolution, it was recognized that at a very high dose, so they increased the amount of these in the body to see. And of course, they do these studies. These are animal studies. They found that at really high levels, so going from kind of a what would be naturally occurring in the body to more of a pharmaceutical level, so like increasing it by 1,000, which is how medications are made. They found that there's actually an effect of weight loss. And so then they got really interested in it, because so far there haven't been medications. There have been attempts at weight loss medications. There have been tons of them, but none of them that are like this. And so one of the things that happens with the GLP-1 medication, in its earlier form, its lower dose form, it has a very, very short half-life, like 2 hours. It's very, very short. As the dose increases into the thousands, it actually increases to a week, so to 7 days. It stays in the bloodstream. And that's really important to know what the half-life. So it's actually the half-life is 7 days. So that means that half of it is gone in 7 days. So that's a really significant change. And so what it does, what GLP-1 medications do, they do a couple of things. One is in the digestive system, it slows down metabolism, which kind of seems counterintuitive. Like
Right,
normally you think like you want to burn it up. But what that does, but slowing down digestion means that you feel full longer, you feel full sooner. So you then don't want to eat as quickly after. A meal lasts a lot longer. It also regulates blood sugar, so you don't get a crash after you eat. It smooths that out, and that affects insulin, blood sugar, and insulin in the pancreas. So it that's also where the application, the effect with diabetes. But then it also works in the brain, and this is really interesting. It's a large peptide, and so it does pass through the blood-brain barrier, and it works with the reward system. So this is where you start to hear people talk about it lowers the food noise. And for the longest time, I'm like, what is that? Well, for a lot of people, they're constantly, like, food is on their mind all the time. What they should eat, what they shouldn't, what are they going to eat next? They're at a meal and they're already thinking about what are they going to eat for the next meal. And it can become kind of this reward. It can be a comfort food, like to reduce anxiety. And we have that kind of chatter, that kind of noise with all kinds of things. Like if you think about, in extreme situations, someone who's addicted, they're always thinking about the next hit, right? Or if someone needs to shop to lower anxiety, they're always thinking about, oh, how can I get those shoes? So there's this, in our brain, there's this constant, like, it's like a radio station that's on. And so what happens with these medications is it tones that down. So that there's not this constant, and it's what people report is that it's really quite interesting to not, they notice, oh, I'm not thinking about food. Yeah. So that's a thumbnail. And I really encourage people, if they're interested in learning about these medications, they're quite fascinating. There are some really reputable scientists who explain it. My favorite so far is Dr. Andrew Huberman out of Stanford on his Huberman lab. He interviewed, this was a couple of years ago, Zachary Knight, Dr. Zachary Knight, and just a kind of a warning label on there. They do talk about animal studies, which can be upsetting to some people, but it's really quite fascinating how it all works, how hunger works, how dopamine works, and how these medicines were developed.
No, thanks for sharing. We haven't had anyone on the podcast talk about GLP-1. So, with it such being growing in popularity, it's great to kind of just give an overview to our audience of like what they do. But so interesting on how they affect your brain too.
Yes.
And how a lot of the people that are using them for weight loss, that's their main focus, but then they realize that there's other things that come up.
For sure. And that,
once they begin.
Yeah, just to say, every medication is going to have different effects, more than one effect. There may be, and in some ways, like that's how we find out what medications can do. It may be developed for one purpose, one effect, but then accidentally we find out, oh, it actually does this as well.
Right.
So, a great example in psychiatric medication is that medications that were originally developed as anticonvulsant, so for epilepsy or different illnesses like that, they found out that they work quite well for schizophrenia. Who knew? Right? And then some of them even for hot flashes. Wow. So just because a medication is developed for one purpose doesn't mean that's the only thing that happens.
Right. But understanding, like you said, how they interact together is so important too.
That's right. Yes. Then when you combine medications, and that's one of the things, I could go there now. It makes kind of sense. So when someone is taking a GLP-1 medication, it slows down digestion, as I said. So food stays in the stomach longer.
Mhm.
There can be certain side effects with that, like if you eat something that's not great, really greasy, or
Mhm.
a lot of soda or something, that stays in your gut.
Mhm.
That might be uncomfortable. Well, even more importantly, if you're taking other medications, whether they're psychiatric medications or thyroid medications, this is really common, those also stay in your stomach longer. And so there's more absorption. That means you might need less of that medication. You might be absorbing more of that medication
Mhm.
than you would otherwise. So that's really an important thing to know about how these work.
Mhm. So you really need to have your whole team on board, right?
Yeah,
Like
that's right.
your medical team,
Yes.
your
Yes.
therapist, so that they understand how everything's working together.
That's right. Yeah. And it also means that if possible, it's really important to get blood levels.
Mhm.
To be testing for what are your levels of medications, and even vitamins. Vitamin D. If you're absorbing more of it, you can get toxicity from
Mhm.
vitamin D, and so it's just important to have that awareness. These are very powerful medications.
Right. And they do amazing things for people. I mean, they're changing lives.
Oh my goodness.
So,
Yeah.
but
Yeah.
making sure that you're educated on what you're taking and how it's impacting you in
Yeah.
particular. Because, your best friend could be on it and impact them completely different
That's right.
than
That's
the way
right.
it's impacting you.
For sure. That's right. Yeah, it's not one size fits all. Yeah.
So there is a lot of judgment online when it comes to GLP-1 medications, and some people feel shame in even considering these medications, or, if they are taking them, bringing it up in conversation or even talking about it with friends and family. So can you talk about that emotional component when it comes to either thinking about a GLP-1 or when you're already on one?
Yeah, it's really true. I would say it's not even online, it's everywhere. And I'm not sure. I think about this a lot, this judgment about this medication. And it seems to point toward obesity in general. And as a culture, we have such strong judgments about obesity.
Mhm.
And we have these examined or unexamined views that if someone is obese, they're lazy, they don't care, they're less than.
Mhm.
And these can be conscious or unconscious. I'm sure everybody has heard somebody, whether it's a relative or somewhere, point out somebody who's fat, use derogatory terms,
Mhm.
and really not have any deep understanding about obesity.
Right.
And actually, obesity, it is linked to genetics, it's linked to trauma, it's linked to generational trauma.
Mhm.
It is connected to both the father and the mother at conception. So it has all of these factors that go way, way, way prior to when someone has any control over what they eat or how they move their body.
Mhm.
So then when somebody starts to take this medication, there can be a belief that, oh, well, that's because they can't do it the legitimate way. There's some
Mhm.
assuming that these are illegitimate medications, which really shows a lot of misunderstanding and ignorance,
Right.
frankly. I think it's also even more so for women. There is such an emphasis on weight, on appearance, and it's such a catch-22 because, okay, so let's say the goal is to be thin. So then someone finds out, okay, I'm going to take this medication. Well, that's not all right. That's not enough.
Mhm.
You have to have it natural. You have to have it without trying.
Mhm.
So it just makes people feel, of course, they don't want to talk about it. of course they don't want to share about it. So then it goes underground. It's a secret. There's shame around it.
Mm-hmm.
When we wouldn't necessarily do that about other medications. If someone has asthma, oh, well, you're not trying to breathe.
Mm-hmm.
You just didn't, you're lazy. You're not breathing. You're using that in, like, we would never say that.
Mm-hmm.
But for some reason around weight, and it is a very much a cultural thing in other cultures, in Asian cultures, especially, now there's so much influence from the West, but in Asian cultures, even a generation ago, it was having more weight was a sign of wealth.
Mm-hmm.
Being thin meant that you were poor.
Mm-hmm.
You didn't have enough to eat. And so it was always like, you need to put on weight because you look poor.
Right.
Here it's the opposite.
Mm-hmm.
Right. So people, especially women, feel very cautious to talk about it. And it's understandable. I don't necessarily recommend that people talk about it because you can't unsay it.
Mm-hmm.
But that said, it can really have an impact on marriages and families and friendships
Mm-hmm.
when people don't know. And some people are even cautious to talk to their doctors about it. Then it gets really dangerous medically.
Mm-hmm.
These medications and how they work, it's such a fast-paced evolution right now that even the medical community doesn't know
Mm-hmm.
how they work. There are a few doctors who are really taking the lead on this, but a lot of general practitioners, PCs, don't know.
Right. You're not learning it in medical school or
Exactly. That's right. That's
Mhm.
right. It's a tricky one to talk about.
Right.
Yeah.
And too, with weight loss, you can't really hide it. Your body is going to change.
That's right.
So of course people are going to notice.
That's right. Yes. And that's where being in therapy can be really helpful,
Mm-hmm.
because it's changing the physical body, and yet our image of ourselves may be slow to catch up.
Mm-hmm.
So we have a self-image. We have a picture in our mind of what we look like, but it may not match up with how other people see us. Often it doesn't. And so people can even develop body dysmorphia, which is having a very different picture of how one's body looks than how other people see it. And it can be really problematic. It can cause a tremendous amount of anxiety
Mm-hmm.
and depression.
Can you also touch on some of the things, like, so say you do consider a GLP-1 medication, like bringing it up to your spouse or your kids or your family, because they're going to obviously start to see some habits of yours start to change. And even eating is going to change. And if you're a family who that's a big part of your family culture, there's going to be some tension there.
That's right. Yeah, that's right. And if it's a woman and she happens to be the one who cooks and shops and everything, her relationship to food is changing.
Mm-hmm.
And so then it's going to have an impact on the family. So finding a way to talk about it it just makes it so much easier, so much better, whether that's needing to get into couples therapy or just having the confidence to say, no, I'm going to try this, and it's actually for my health.
Mm-hmm.
One of the things that these medications do when they're used properly, and it's really important to use them properly, is that it really lowers the cause of inflammation, the cause of a lot of cancers, and that's the visceral fat. And so these aren't just used cosmetically. In fact, they're not recommended cosmetically. These are medications to treat obesity and to treat visceral fat. And so someone on the outside might not look larger, but if they have more visceral fat, they're at risk. So then when you have someone on a medication that's changing their relationship to food, and then in their family or with their friends, it's very similar actually if someone gets sober.
Mm-hmm.
There's an adjustment, and there can be subtle or overt pressure to drink. Oh, I don't want to hang around you anymore because you're not fun.
Mm-hmm.
Oh, it's just one.
Mm-hmm.
You can have just one cookie. You can just, and there can really be, it's like a perceived threat to the people who aren't on the medication. But I think on a positive note, in the best case scenario, is that when there's a family who's not been eating well, and then one person is on a GLP medication, it can actually help the whole family eat better
Mm-hmm.
and have better habits and have more awareness of like, why am I grabbing for those chips?
Mm-hmm.
I don't really want them.
Mm-hmm.
They're not going to benefit me, really,
Mm-hmm.
you know? So that's how it can be really of benefit, you know, when somebody starts making a change
Right.
in their habit.
And inside of therapy, are you coaching your patients how to bring up these, conversations then with spouse or kids? And
Yeah. And to also really understand where the hesitation might come from. There might be a projection. So someone might not want to tell their parents. Well, what's that about?
Mm-hmm.
You know, there might be kind of an unexamined projection that their parent would be really judgmental about it,
mm-hmm.
when that might not be the case.
Mm-hmm.
So it's helpful to really look at like, well, why would you or why would you not?
Right.
Before kind of impulsively saying something or not.
Mm-hmm. Mm-hmm.
Yeah. But it's a very personal, it's a very personal question. And like you were saying, people notice. And so, and for some reason in our culture, we feel it's either it's one or two, it goes one or two ways. Some people, they feel so kind of entitled to make a comment about somebody's body. Oh, you've lost a lot of weight,
Mm-hmm.
kind of, and then it's like,
Mm-hmm.
or nothing is said, and somebody has lost 50 pounds,
mm-hmm.
and nobody says anything.
Mm-hmm.
That also doesn't feel very good.
Right.
Yeah.
Because you wanted, you were taking it for a reason,
Yeah.
and if no one
That's
is
right.
commenting on,
Right. Yeah, it's really tricky. And there's such an opportunity when there's a transition, and this is something that, in psychotherapy in general, I really view transition as an opportunity to explore things that have been just on autopilot.
Mm-hmm.
And so whether that's menopause, whether that's a change in how someone's parents are functioning or kids are functioning or one's own body, it's an opportunity to get really clear, like, oh, well, how am I thinking about that? Is it accurate?
Mm-hmm.
Is it serving me to think that way? Is this an old habit?
Mm-hmm.
So this can be in a family too.
Right.
Yeah.
Okay, so this year on the podcast, we are collecting community questions for certain podcast episodes. I asked our community, I said we were having this conversation today and was collecting some questions. So the first one is, has anyone else's marriage or relationships changed since starting a GLP-1? So we clearly have kind of touched on this, but do you want to elaborate on that?
Yeah. It does change relationships. Some relationships don't survive. Mm-hmm. Some relationships get deeper, get better. Sometimes in a relationship, one person will start on a GLP-1 and then the spouse will decide that it's a good idea. Mm-hmm. But there can be a lot of fear at first, I think, when one person starts taking it, and if they're letting their spouse know, which, I mean, this is a powerful medication. Mm-hmm. It's good to let people know in case there's some kind of side effect, but there can be a fear of like, oh, are we not going to enjoy food anymore? Mm-hmm. Food is my love language. Mm-hmm. Food is the way that we've shared all kinds of anniversaries, and so is that off the table? No pun intended. Is that off the table now? So it does have an impact on marriages, mm-hmm. on relationships. Doesn't mean that there's nowhere else to go. Mm-hmm. It may mean that food is, or at least the types of ways that food has shown up can change. And it doesn't mean that people don't enjoy foods. It's just different. It just changes that relationship. Mm-hmm. It's not in such an addictive way.
I've even heard people come up, like, say in conversation that they'll reduce their medication amount, like leading up to holidays and things like that, so that they can actually enjoy the food.
Yes. And that's a one of the ways that people are working with these medications that are more nuanced. So, and it's a great way to work with these, because these medications, they're not long term for everybody, but really that's the design. And for a lot of people, they are long term in small doses and in ways that make sense so that people can continue to live their lives. So, for example, holidays, or say somebody is going on a trip that involves food, a cruise or something, or going to another country where they want to enjoy the food, they might, in coordination with their doctor, they might pause their dose for that period of time and then come back. It's fine to come back onto these medications. You know, it's not like with some of the other medications where you crash off it or something, or it's dangerous. It's not. So people work with their doctors that way. Sometimes people will lower the dose. Sometimes people want the dose because those kind of meals can be overwhelming. And so to have a little bit more enjoying the company rather than just being fixated on the food. So there's ways to work with it that are really allowing for more kind of life. Yeah.
I love that we're talking about this. And just like, you know, this is stuff that people are going through in their head, and just being able to share that these are normal thoughts, and like it's okay to have those questions. And
it's
feelings.
I think that's part of the stigma around it, is that people don't know that these questions are even okay, so they just reject it.
Right.
They reject the concern, or the, you know, oh, I shouldn't be feeling that way, and that's not true.
Yeah.
You know.
Yeah. No. So good. So another question, kind of very similar. I'm not enjoying food, wine, or going out with friends the way I used to. Is this common?
It is. And that goes right to that pleasure center of the brain. That means it's working. That means it's working. And it's it takes a little getting used to, because these medications work directly with that kind of the dopamine of it's the pursuit of the drink. And by the way, kind of sidebar, these medications are also being studied for addiction to alcohol. Right. And so that craving, oh, that glass of wine is going to be so good. Actually, the pleasure center of the brain is already working with the thought way before the substance. And for someone who has addictive kind of tendencies, cutting it there is really the most important. Right? So it will be a transition. It doesn't mean that you can't enjoy being with friends. But it may take some getting used to it, and it may take some kind of self-inquiry around, oh, do I need to be buzzed? Whether it's from food or from alcohol. Do I need to be distracted to be around my friends? Or can I actually be around my friends just me? Right. You know, that might feel a little uncomfortable. And again, that doesn't mean that you're, you know, a weak person or a lesser person. It may be that you have a little bit of social anxiety.
Let's talk about that, right? Let's work through that.
So. Yeah, exactly. Exactly. Yeah. Or there may be some judgment from your friends.
Yeah. Now you're so much more quiet.
Yeah. Yeah. Or how come you're chasing your food around your plate? Somebody mentioned that. Oh, you're on a GLP. Are you on a GLP-1? Because you're just
moving your food around.
Oh my goodness. Yeah.
Alrighty, so circling back around to some other things that people might be considering, especially once they've been on the medications for a little while, is, okay, I'm at my goal weight. What does that mean from here? Is insurance still going to cover it? is this something that I need to be on for the rest of my life? Can you kind of touch on some of those things as well?
Yeah, those are so important. The pharmaceutical companies are asking those questions as well, actually. So one of the things that's really interesting about these medications, and I've seen this with clients and also on online forums, is that typically people are working toward a goal weight. They have a weight in their mind that they want to reach, whether it's for health reasons or just that comes up in their mind of when they were their healthiest. So one thing that's really interesting as they're getting toward that weight is dopamine is firing. Every time they go down on the scale or they go back up, dopamine is like, oh, I'm moving toward a goal. That's how dopamine functions. It helps us survive because we're always striving. It's not about the reward at all. It's about the striving. So then when someone reaches a goal weight, then what? So that can be a really challenging period of time. But this is one thing that I find so fascinating about as people are going through this journey, if you will, they can have memories come up, that memories of things that happened when they were at that weight before. And they can be these unconscious, like, whoa, things that get kind of released. There may be a trauma involved. There may be, for example, someone who I know of is at her high school weight, and all of a sudden she's thinking about high school type things, and high school wasn't that great. So again, it can be a helpful process to be in therapy. I'm a therapist, so I have that bias, but to be looking at, what's coming up for you as you're at this weight, because the weight comes off slowly, and for someone who's needing to lose a lot of weight, it can take years. So then getting to that goal weight, whatever that is, decided with a doctor, then again, it comes to what's next. And there can be a lot of unexamined assumptions. Oh, I thought when I got to my goal weight, I would get a job. Really? Well, how would that happen? Oh, I thought that I would meet the man of my dreams or the woman of my dreams. Really? Where'd you get that idea? So these unexamined ideas, and it's not I'm not saying that in any way like, these people are stupid. It's just unexamined. And so there can be these assumptions that I'm going to be happy if I'm at that weight. There can be an association between weight and happiness. And that can lead to a lot of disappointment. These medications, being on these medications takes a lot of work. There has to be a very close attention to the amount of protein that somebody eats, the amount of strength training that people get so they're not losing muscle mass. So people have worked really hard. It's not like they've just been taking the pill or injecting themselves. And
and there's a financial component too.
They are very expensive. Most insurance companies don't cover unless you reach certain criteria. So there's a lot of talk about the cost of these medications and attainability of these medications. And so then the other thing that where a lot of the medical community and insurance communities haven't caught up is that these medications really are designed to be on long term. There are there's a lot more research that's happening now for either shorter term. It just depends on people's individual circumstances. Have they been obese their whole life? Is there a genetic, predisposition for it? Is there diabetes in the picture? So those kind of questions. For people where the weight came on more suddenly, say menopause or postpartum birth weight, those kind of things, they may not be on them forever, or they may be on a microdose. These are all kind of what's the future of it. And the answer is not there yet, but there can be a lot of anxiety around, well, my insurance company just cut me off I'm at my goal weight, and now am I going to gain it all back?
Great.
Like, how does this even work? So really being educated about how these are working, what is the latest, data that's coming out, because there's a lot of money. This is a big business, and there's a lot of money going into it. That it can be easy to just focus on the scale, which is only one unit of measurement. The other units of measurement are really more important, and that is, what is your body composition? So we haven't talked about body composition scales. So body composition scales measure not only your weight, but also how much of that is muscle and bone, how much of it is visceral fat, how much of it is water. So finding one of those is really important to track, because that's your overall health, and these are designed for that. And then, what are your unexamined assumptions about when you are at that weight? And when we talked before, sometimes people gain weight, especially women, but not exclusively. They put on a lot of weight as a defense to a trauma. So if that's true, and this isn't consciously, it just can happen. So then once that weight has come off, people can feel extremely vulnerable. And so it's important to know and to really be working on that. And developing the skills and the confidence to work with that. If there is a trauma, and
there are people that have experienced trauma and they hold on to weight because they don't want people to look at them.
That's right. It's a natural defense to become invisible. And so then all of a sudden, someone is visible and is attracting attention and is attracting comments. And it can produce a lot of anxiety.
Right.
Yeah.
When you were talking too, I was also thinking, like, people, once I get to this goal weight, my life is going to be so much better. Same thing with money. People are like, once I have all this money, I'm going to be so happy.
Yes, exactly.
But maybe when they get that money, they're like, I'm not satisfied, or I've ruined all my relationships.
Yes. It's with any object that's outside of ourselves. So, if only I had a baby. Well, if only I had a house, if only I had a spouse. It's the same process. It's the same mechanism of thinking, externally. If I change something external, then I'll be happy. That's not where happiness comes from. It really comes from within one's own mind, and making friends and being supportive of oneself from the inside. Then that radiates out. If we just expect it to come from outside, we're constantly disappointed, because it just doesn't work that way. Really, for people who are considering these medications, regardless, there's a book that I really recommend called Weightless, by Rokio Salas Whalen. I don't know if you can see this, but it's a really helpful guide to how to think about being on them. Why is protein important? Why is strength training important? How are they developed? And she's done a nice job of kind of putting that all together. How do you eat? How do you think about food? What do you eat first? Like she recommends, like, if you've got a plate of food, eat the protein first, even down to that kind of detail. So finding something like that, I like that book. I recommend it all the time to clients. But, finding something that is a reputable person, reputable in the field, and then thinking about, how is this impacting me emotionally? And just to say, I'm not a medical doctor. I don't have medical training, but I do work with people who are on all kinds of medications. And so how does that impact emotionally? And how are they talking to their doctors?
Right. And talk to your doctor about it.
Yeah. Talk to your doctor about it. And if your doctor is giving you a lot of pushback on it, get curious about that. Get curious about that.
Right.
What's their background? What's their relationship to the medication? Is there something in your, physical makeup where it's really not a good idea, or is it just somebody's opinion? And you can get a second opinion. That's fine.
Yeah.
You know? Yeah.
Thank you so much, Gretchen, for being another guest here on the Erie Wellness Podcast. I really enjoyed our conversation, and really, I'm so excited that we were able to bring up this topic, just because I know that there are so many people in our community that are having these thoughts, and I want it to be a space where there's other people that are thinking the same way that I am, or having these questions. So thank you so much.
Yeah. Thank you. Thanks for coming back. And it's so fun to be on your podcast. You asked such great questions.
Well, thank you. I loved our conversation with Gretchen on the Erie Wellness Podcast. Her insights that she provided for listeners, background on GLP-1s and the emotional and mental side of it is really enlightening, and hopefully educates our community on what's really happening for those who are considering GLP-1 medications who are already on them. And thank you everyone for listening to the Erie Wellness Podcast. If this episode was helpful, please share it with a friend and be sure to connect with Gretchen if you'd like additional support. We'll see you next time on the Erie Wellness Podcast. All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time.